Awesome. Well, first of all, thank you for having me here today. I know this is a really long session, so hopefully no one's sleeping just yet. And I am probably one of the last folks in between lunch, so I'll try to make this somewhat quick. So I've been at Lyft now for 2.5 years. A little bit about myself. When I started at Lyft 2.5 years ago, Lyft was doing about 1 million rides a week. Today, we do over 1 million rides a day, over 10 million rides a week. When you think about our ability and impact for our elder, low-income, at-risk populations, it is absolutely tremendous. Maybe by show of hands, how many people have heard of Lyft? Okay, good. How many have taken a Lyft? Okay, great. So we have a few people to convert still. I've been in healthcare for over 15 years. My family and I, we actually operate one of the largest home care businesses in the Bay Area. So we have about 500 caregivers helping our elderly with activities of daily living, mostly non-medical. I've worked in consulting, investment banking, and healthcare. I've had a startup primarily in the elder care space. And I've also been a caregiver for my grandmother. I'm first-generation American. My entire family, including my sister, immigrated from the former Soviet Union to New York City. And my 90-year-old grandmother would only leave her apartment maybe once a week when my father and I would come visit her from New Jersey. You know, imagine if I was able to order a ride upon her behalf. Imagine if I was able to know where my grandmother was at all times. And she was fairly ambulatory. I would have argued her quality of life would have been that much better. When we think about the reduction of isolation and the increase of independence for our elders, it is absolutely tremendous. And actually, coincidentally, just today, if you look up, there's an article in Fast Company that came out this morning. We have a partnership with AARP. United Healthcare is paying for Lyft rides for AARP members at USC Keck School of Medicine. We've done over 5,000 rides over the last couple months, and we've seen a 90% increase in quality of life for our elders, and that's one of many studies that are out there today. So real quick, this slide literally changes almost every conference I go to and every time I speak. Today we touch over 95% of the US population. We have well over now 1 million drivers on the road, and as I mentioned earlier, we do over 1 million rides a day today at Lyft. So one thing that is clear in my personal experiences and also being a caretaker for my own grandmother is care starts with transportation. And the one statistic that if you've ever read anything about this industry that's overly used now quite a bit is this number right here. About 4 million medical appointments are missed or delayed every single year because people can't get there in the first place. The other thing is there's been a lot of studies and data out there when we think about non-emergency medical transport. It's over $150 billion burden on our healthcare system. University of Florida did a study on this. For every dollar spent on transportation, there's an $11 return to a health system. And the other thing, which I've just said, this has been, again, published, and there's a lot of data out there around this. Now, I'm sure you've heard of that other company that's out there today. Yes, we do have a competitor. The one thing that I can't stress enough, and I've seen this in my, I might be drinking the Kool-Aid just a bit, but our mission, our values as a company at Lyft cannot be more different than others out there. Our mission statement at Lyft is to improve people's lives with the world's best transportation. Most people don't know this, but when Lyft started in 2005, our original mission was to make a female feel safe getting into a car with a perfect stranger. And that's where that funny-looking pink mustache in our branding came from. To this day, 60% of our passengers are female, 40% of our drivers are female, and something we're very proud about is over 50% of our leadership team is female. So we've really come about this a lot differently, and that's why healthcare, if you talk to our founders, is extremely important. My healthcare team is part of our entire enterprise business at Lyft. Our enterprise business at Lyft is a $1 billion run rate business. So when Lyft first got into enterprise, it was working with Fortune 500 companies to use Lyft for corporate travel. So perfect example is Apple. My wife works at Apple. She's been there for 10 years. We are their corporate travel partner. So for ground transportation, all employees use Lyft for corporate travel instead of a rental car or a taxi. The healthcare business is the fastest growing business within all of enterprise within Lyft today. When I started, there was 2 of us working on it. We're over a team of 30 now. So I'm gonna go through this a little bit quick. The natural question is, okay, this sounds wonderful, Dan, but how many of our elders, low income, have a smartphone or even know anything about Lyft, which is a fair question. It's actually a funny story how Lyft got into healthcare. just over 3 years ago, we saw one app in upstate New York, one consumer app, ordering thousands of rides a week using Lyft. Immediately, all the bells and whistles went off. Our fraud team investigated, and we said, it has to be fraud. What ended up happening was a non-emergency medical transportation broker who coordinates rides for Medicaid recipients was using Lyft to get their members to and from doctor's appointments in upstate New York. That company was called National MedTrans Network. They were our first healthcare partner. And we instantly realized there's an opportunity here. So we built a tool, we call this Concierge, where a partner, whether a health system, whether a transportation broker for Medicaid, or whether a technology partner that services our elderly, they can order rides on behalf of somebody else. So the passenger does not need a smartphone, does not need to know anything about Lyft. These rides are ordered for them. And we also have an API where our partners can fully integrate this into their current systems. So it's very simple. It's fully HIPAA compliant. The dispatcher, the person at a hospital, so we work with Dignity, Sutter, UCSF, Hennepin County Medical Center, they're all using this dashboard. And basically they go in, I'm with the patient at the moment of discharge, I can enter their name, a contact number if they have a mobile device. If not, it can be the number of the dispatcher, pick up and drop off location, and then our ride is then requested for that patient. We never share the real name of the passenger with the driver. Driver just sees first name and last initial. And we never share the real phone number with the driver. Driver gets a random phone number. They dial it. It routes to the real number. They don't know the difference. And you'll see here they can also schedule in advance. They can schedule up to 2 weeks in advance, or they can order on demand as well for that patient. Now, one thing I'm really proud about, I've been working over the last 2 years or so with many EHR platforms. We just finished integrating with Allscripts. Allscripts is our first EHR partner. So Allscripts has a platform they call Sunrise within their Reg Schedule system. A case manager, instead of going to the standalone tool, and I've spent a lot of time with case managers and social workers in my lifetime, opening up another tab we know is difficult. So by taking our API, we are now fully embedded within that EHR. With a dialysis patient, that dialysis patient needs the next 5 appointments scheduled. With a click of a button, a Lyft is now available for them. They can order it on demand or have it there in the future. Here's just a flavor of some of the things we're working on. I mentioned the broker use case. So we have exclusive partnerships with the 10 largest brokers in the country. Logisticare is the largest non-emergency medical transportation broker in the country. Logisticare last year did 70 million rides for Medicaid recipients. 85% of those rides are ambulatory curb-to-curb transportation. Historically, they were using taxis. Now they're using Lyft. Our value proposition, we're easily 30 to 50% cheaper than a taxi or livery provider. We provide full transparency, so they literally know where our vehicles are at all times. They know when the member has been dropped off. And then finally, when you think about waste, fraud, and abuse, we've significantly dropped that down to just a percentage point now compared to the old ways. We partner directly with health systems. Ascension is one of our largest health systems, the largest not-for-profit health system in the country. Ascension, across their ministries, they have about 300 ministries today using Concierge. Ascension is going to be actually one of our first partners to use the Allscripts integration. They have a ministry in Indianapolis that uses Sunrise. We do a ton of work in senior care, and this is something that I'm really passionate about given my background. We're fully integrated with Brookdale, so the idea there is I'm a senior living in the community. I can go or call the front desk. I can ask I need a ride to a doctor's appointment or at a grocery store to see friends and family. That associate at Brookdale can now order a ride upon my behalf. If anyone here is sort of the jitterbug phone, the jitterbug phone is specifically designed for our elders. If you have a jitterbug phone and you dial 0, you can request a Lyft. We fully integrate into that platform. And many of you may have heard Jitterbug is made by a company called Great Call. They were just acquired by Best Buy, one of their largest acquisitions ever, or the largest. And then finally, we're doing a lot of work with payers. So we have a partnership with Blue Cross Blue Shield and their association. One of our early payers we worked with was CareMore, which is an MA, Medicare Advantage plan in Southern California. And we also have a great partnership with IEHP, Inland Empire Health Plan. There was actually a study a few weeks ago that was just published. We've done 70,000 rides for their MA members. And we've had concrete better outcomes, reduction in costs, better patient satisfaction. And the amazing thing is when you start thinking about population health, when you think about social determinants of health, the plans are now starting to provide Lyft rides to things like a rehab or a grocery store or a clinic. So there's a lot of other use cases that they're using Lyft, not just only to a doctor's appointment, a PHP appointment, or a hospital visit. I'll go through this real quick. There's some case studies and data that's been published. ALC is another transportation broker. IHP works with ALC. And some of the data around reduction in better satisfaction rates, reduction in pickup times, and higher efficiency for the plan. And then finally, one last case study here, OneCall. OneCall is the largest workers' comp benefits platform out there today. They fully integrated Lyft into their mobile app, so now I'm out on the job, I get hurt, I now can go into the OneCall app and I'll find a physician, and I could get there via Lyft using their mobile app experience. And that's their dashboard. And then Denver Health, great partnership there. We've done a lot of work with them, Blue Cross Blue Shield. And we're really just getting started with our work. Thank you.
That's awesome. Questions before?
How can you adapt this model to the rural and less urban areas?
Yes, that's a huge area of focus for us moving forward. So as I mentioned earlier, 95% of the US can open up a Lyft app and order a ride. Certainly our ETAs in more densely populated areas are much better. So on average, our ETAs across the country are 3 to 5 minutes. Once again, into more rural neighborhoods, they're not gonna be as strong. However, we firmly believe we are the best option out there today, especially in rural markets when there's very poor options to begin with. For us, it's how do we continue to expand our network? One interesting thing that my team is working on is transit partnerships. So really cool example there. The city of Monrovia, if you're a resident of Monrovia, anyone in this room can do this today, open up your Lyft app and type in the promo code GO Monrovia into your Lyft app. If you type that in, it will cost you 50 cents to take a Lyft anywhere in the city of Monrovia, and the city of Monrovia is paying for the rest of that Lyft ride. Monrovia took $1 million from their dollar ride budget and put it all towards Lyft. Many cities are operating at bus lines at 10% occupancy, huge cost centers, and now we're pushing and looking at models, alternative models, and working with companies like Lyft to power their transit solutions. So in more rural markets is another great benefit we have there given our cost effectiveness. But that's a really important question and a good thing you bring up, and something that we're working on.
What are you doing for disabilities, wheelchairs, that type of thing, if anything?
Yes, so we're doing a lot. Right now today, we believe we are the best option for ambulatory curb-to-curb transport. In about a dozen markets, we do have wheelchair-accessible vehicles, and we can do door-through-door transportation. We're just not national yet. And there's actually a setting in the Lyft app, if you go to your settings, that you can select Lyft Access, which is a wheelchair-accessible vehicle. Now, we still got a lot of work to do. That said, we also partner with many home care providers. So we have a national partnership with Comfort Keepers. We have a partnership with Home Instead. CareLinks, if anyone's ever heard of CareLinks, Sherwin Cheek, the founder there, is a really good friend of mine. They have 300,000 licensed caregivers in their mobile app. They fully integrated Lyft into that experience. So now you can order one of their caregivers and also have a Lyft available. So you can have a licensed and qualified caregiver in the vehicle, taking a parent, a loved one, to a doctor's office or to wherever they need to go. So through these partnerships, we can have that caregiver. Now, we can have a whole nother talk about the work we're doing in autonomous, and there's a lot of interesting things coming down the road, and Lyft is a big player in autonomous vehicles. Imagine if you can order an autonomous vehicle, but instead of a driver now, you have a licensed and qualified caregiver in the car. So it's still early days, but there's so much more we can do. That said, when we partner with a health system, we don't say we're going to do 100% of your rides. If we do have wheelchair-accessible vehicles, we will provide them. But for the most part, the majority of our work today is those ambulatory trips.
Prescription delivery?
Yeah, so there's a lot of interesting things happening there. Historically, Lyft has been very focused on people, unlike our competitor. We haven't really gotten into logistics. Now, that said, I personally believe there's an amazing opportunity when you think about pharmaceutical delivery. Our partnership with Blue Cross Blue Shield and the association, we're actually doing a lot of work with them right now, getting people to a CVS or a Walgreens to pick up their medication. So we're actually doing a lot when there's taking somebody to the pharmacy. Imagine we're discharging a patient. On the way home, we know where the nearest CVS is. The driver can stop and they can pick up their prescription. We're thinking about how do we do more and actually bringing the drug to the patient. I can say it's still early days, but there's clearly an opportunity there.
Just to follow up on the previous question about the elderly and disabled, one of the issues we've had with some of our patients when they get picked up after a surgery, for example, have you had any discussions with health plans regarding liability?
Yeah, so a couple things, and this goes back to my earlier comment. We never suggest we're going to be a fit for 100% of the population today, especially for our core network. Certainly there's going to be folks who come out of a surgery who might need a wheelchair accessible vehicle, might need somebody to go with them. A Lyft wouldn't be a viable option. Now that said, the way our platform works is if you want to drive for Lyft, you must have your own vehicle insurance. In addition to that, we procure an additional $1 million of general and auto liability coverage on all our rides, and we are the primary insurance provider on all our trips when a patient's in our car. I can tell you we've spent a lot of time with legal counsel and folks at health systems, and obviously they got to feel like working with Lyft is a viable option and can cover them for those types of risk, and we've been able to work through all of it. The other thing is there's no additional cost for more people in the car, so a caregiver, caretaker, family member can always be there if they need additional support. But again, we're really focused on those ambulatory curb-to-curb trips.
Thank you so much. That was amazing.